which of the following means yes in Russian language? So that would be нет, да, or пока. So the three words. How we gonna do it? Are you gonna answer it in a chat?
Da.
Wait, Galina. I'm so sorry to interrupt. These are questions are really important. We're gonna do them pre and post your lecture, so don't give.
Oh, don't give. Okay.
Yeah. So guys,
okay.
So there's a form that Jolene sent. So
please don't get excited. Ahat, I heard your voice. Please do not get excited.
Ahat, you can put them in, but
we'll in. Just
and then Galina, just send them again post, okay? Okay, sorry to interrupt.
So these three questions: how likely is the Russian-speaking patients can participate in a research study, and some of the things like so. Just a little bit of like a history-wise, which of the following periods best encompasses the population born in the former Soviet Union is most likely to speak and understand the Russian language. So this is your pre-test questions. Do you do you answer it before and then after we do the lecture you'll answer them again? Okay.
Correct. Yeah.
Very good. So send it on the chat, I guess, your answers, or how do we do it? Srinath.
So the same survey is going to be sent after the lecture, and we will fill it out.
Okay. All right. So
if you have more questions outside of the survey, I think we can just choose people and ask them to respond.
Sure. Okay. All right. Okay. So in the objectives, we're going to talk about a little bit of challenges of the language barrier. It's kind of like not just for the Russian speaking, but probably in general for any patient who does not speak English. Brief introduction to our history of people born in Soviet Union and why is that important, and understanding how the cultural challenges of Russian speaking population when we provide the medical care for them, and then of course NIH in Russian language. So so challenges of language barrier during the stroke code. Some of the barriers that we definitely know is the lack of satisfactory translation resources in a timely manner, right? So we a lot of times we cannot find that person who does speak the same language. We cannot find the interpreter because interpreter at that time is busy with another patient translating. Or we cannot even find that little machine that helps us, or the phone service doesn't work. So sometimes we don't have the resource to help us to translate for that patient. Then we have sometimes the other challenges is the limited time to spend with each patient. So if we rushing, we have another consult to see, another code to see, and then you have a patient, a lot of them. And so you cannot really spend that much time because the translation sometimes doesn't get really well translated, even with the translators. By the time the patient hears it, by the time they relay the message, it takes time. And then, of course, families' confusions and incomplete understanding through the translators. So I wanted to, if anyone can share some of your challenges. Can anyone share some of your challenges that you do work with every day? Okay. Minnie Kim, can you tell me any challenges that you acquired with the challenges of the language barrier during the stroke codes or your consults? Minnie, you here? Okay. Minnie is not responding. How about who else we have here?
Galina, what was the question that you just asked?
I asked to share some of your challenges of the language barriers during the stroke codes or during the consults.
Yeah, I think it's exactly what you said. It's like time management. It's hard, especially when you have a Cantonese speaking patient and in-person interpreter isn't right there, and everybody on the team is either English or Russian speaking most often at MIMA. And if the family is not at bedside, getting that interpreter, it takes up at least 5 minutes of your time, even if you're just trying to get the iPad or somebody on the phone. At county, it's not Russian or Chinese, it's most often Haitian Creole. There is, unfortunately, a large population of Haitian Creole, either nurses or PCAs, but sometimes those aren't really the most appropriate people to ask for help. So it is a challenge and it's a barrier to care for these patient populations.
Thank you, Liz. Yes, of course. I want some other people to participate, except Liz. I'm sorry, I'm calling some names. I just want to see if people are paying attention or definitely can share something else that they've encountered, how difficult it was, or like that for us to actually get this history. Did you have something else to share? If you do have, and please share with us. If not, we'll just move it on.
I think the same experience with me when I was a PGY2, I had a lot of patients for some reason. Most of my TPAs were Creole speaking during my PGY2 year. And it's frustrating because the families become important in translating and they're not there. So it's a huge barrier. But surprisingly, I think there are some studies this year which show that the door to needle time and the mortality doesn't really vary between English speakers and non-English speakers, but I doubt if that's applicable, to all stroke centers.
Yes, that is so true. We encounter like on a daily basis these challenges, and in some cases we have difficulties when it's like one of those rare languages, but then there's also cultural, not just language wise, but the cultural goes together with the language. So we can, we have a lot of those experiences, especially when we doing the TPA or TNK. It's unfortunately really tough. We sometimes have 3 phones with people talking, family, then the other family and the attendings, and it's a lot of things at the same time. So thank you for sharing that. So what I also wanted to, not just like, when we say in Russian, so when we saying about the Russian speakers and people who can definitely understand Russian language, I want you to understand that why those patients that sometimes from different countries, that it used to be former Soviet Union, and why is it so important? Because then you will kind of picture it for yourself. If you know that this patient is from Armenia, Azerbaijan, Georgia, Moldova, or Ukraine, or Uzbekistan, and if they were born like between 1921 and then 1991, they were very much exposed to the Russian language as a mandatory subject in the schools where they grew up. And when they migrated between these countries, it was a lot of times where they had to complete the school in one country, and then they would actually send them, because during the Soviet Union, they had to fulfill the needs of the other, countries that they really needed those specialties. Like in a small town where I grew up, we had teachers that came from all over the world, but they were teaching different subjects, but they were actually sent to us, and they kind of build up their families. And so that's how it was kind of during the Soviet Union. So I just wanted to bring this a little important subject, just for you to picture it for yourself, that people with these 15 republics, they can all speak, they can all speak Russian. So, which is really important, because if you do get a patient from that just came in recently from Ukraine, but it could be a younger patient, might not really speak Russian because of the Soviet Union already fell apart in 1991. So, but that's kind of like a little bit of history for all of you. So then the cultural challenges of the Russian speakers. So please remember, patients that speak that Russian population patients, they might be seeing multiple doctors of the same even disciplines. So you have to like get and obtain total history of their doctor visits. They might have 2-3 cardiologists at the same time, where they might have also a few PCP doctors, and they tend to be non-compliant with the medication regimen. They know what they sometimes tell you. I'm not taking this blood pressure medication, I just don't feel like I need it. My blood pressure was normal. And that's how they tend to skip a lot of doses. They don't comply with a lot of anticoagulations as well. So just be prepared that this is the culture, that you might have these challenges, which is going to be helpful for you. So that could even go for seizure medications, because they might be able to, they might be drinking and not thinking that the seizure medication would be affected by the drinking. So important history taken, important, knowing where they go to, how they really taking their medications. And another important thing that Russian speaking patients really don't like the research studies. They don't like to be studied on. So they will tell you up front, they're not like really, they're not really a fan of those researches. Just like I would say Asian population, they also don't like it. Some of them they do, but So the NIH is in Russian language. I mean, it's really hard. I don't even know if you can read it, how I wrote it. This is how it sounds in Russian. I'll try to say it. Then we can practice a little bit. And at the end, I created basically the simplified form, which our teammates who are like, the Asian, my Asian coworkers, they learned it, they really use it well, and they get their exam done even without the Russian translator at the time sometimes. So if we're saying like, what is the current month, you would say, какой сейчас месяц? Who can try to read this, except Ahat and Dr. Cherniak? Should I call people, because people not really participate? Oh, Dima. Dima's here.
Yes,
Hi.
I'm here.
Hi, Dima.
Hi, how are you, Galina?
Can you try to read this, the first one? What is the current month when you're saying to the patient? Can you try to read it?
I mean, I can repeat after you if you read it. Yeah.
Какой сейчас месяц?
Какой сейчас месяц?
Very well. So any Russian speaking could understand you. Thank you, Dima.
Oh, thank you.
Okay. How old are you? So how old are you is сколько тебе лет? Who can try to read this? Okay, how about Hazel? Hazel, you here?
Yeah. Сколько тебе
Тебе лет.
лет?
Good. Сколько тебе лет? Great. Okay, so if you wanted to say, open your eyes, that means открой глаза. Or close your eyes is закрой глаза. So от, it's open, it's like открой, and закрой, it's close your eyes. So открой глаза, закрой глаза. Who wants to try this one? How about Ben? Ben Morrison, please.
Oh, sorry, Ben just stepped out, but I can try again. Открой глаза, закрой глаза.
Perfect. Открой глаза, that means you're saying open your eyes. Закрой глаза, it's close your eyes. Before we really, I move on to this, I just wanted to also bring one more point that actually is very important. When you examine the patient with possible who has like strokes or neurology, your patient that you see it, your first impression when you look at the patient, it's not just how you're going to be examining, but when you look at the patient, you already see certain things that will give you hints, will give you points for what you're looking for. So let's say like if you have a large vessel occlusion patient, you know, when you see in a patient and patient is looking just towards one side, I mean, of course, it can be either seizure or the large vessel occlusion. It could be something else, of course, but most of the time, if you see that patient has this gaze deviation and you have this paralyzed one side, that already like you see that the spontaneous movements of the other side, but this one doesn't move, or you see that the patient doesn't even tries to speak, but not able to. You already get your exam. Certain things you already know what you're looking for. What are you gonna do with this patient? So so your first impression by observing, you can also get a lot of things already on your list. Okay, so let's moving on with the, when you say make a fist, right, or open your fist. So to make the fist, you say sojmi kulak. Who wants to try this one? So it's a make a fist or sojmi kulak. How about Jolene?
Sojmi kulak.
Great. Okay, so and if you want to say open your fist, you're going to say razojmi kulak. So you see, like, open your eyes or close your eyes. You have открой глаза or закрой глаза. So like those few, a little bit of a few words that's just added on to the ending. So открой, закрой. So you see, like, крой is there, and then you just put открой, закрой. The same thing. Сожми, it's like make a fist, but разожми, it would be, so you see, like, жми would be there, but you're just adding сожми or разожми kulak. So who wants to try разожми kulak? It's open your fist. How about some folks from SUNY OB residents? Anyone wants to try from SUNY OBH residents? Who are those? It doesn't say the name, so I cannot really call it. What about Isil Yinis Balevi?
Hey, okay, let me try. Razojmi kulak.
Great, razожми kulak. Very good. I like it. Okay, follow my finger with your eyes. It's really hard. It's like if you say to follow the finger with your eyes, you're gonna say, it's a tough one. I don't know if you'll be able to. I have the more simplified one, but this is just if you wanted to really be a little bit more advanced. So you're gonna say следите глазами за моим пальцем. So следите глазами за моим пальцем. Who wants to try this one?
I'll take it.
All right.
Следите глазами за моим пальцем.
Good. Very well, Sinat. Okay. So this is the long one. When you say, look at my nose and tell me when you see movements. So you're testing your visual fields. So that's it's a challenging one, but смотрите на мой нос. So you're saying, like, look at my nose. Смотрите на мой нос и скажите, когда вы увидите движение. Движение is a very tough word, but who wants to try it? Who wants to try it? Смотрите на мой нос. Скажите, когда вы увидите движение. How about Shruti?
Oh my God, Galina, you gave me the hardest one.
I know, Shruti, I love you a lot. I love you much. Let's try.
Okay, let's try. Смотрите на мой нос и скажите, когда вы увидите движение.
Wow,
I'm so sorry I butchered it.
You did it. Shruti, thank you. You did it. Okay. Smile, it's going to be ulibnitis. Ulibnitis. It's I mean, all my coworkers know smile. How to say? They say smile, so it's ulibnitis. Who wants to try it? Liz, how about you? Try it. Ulibnitis.
Ulibnitis.
Very well. Very well. Okay. This is a tough one. Okay, lift your arms and hold for 10 seconds. So again, in the simplified, I will show you just a few things. You don't have to say, you know, hold it for 10 seconds. You're just gonna say, just lift your arms. So lift your arms and hold for 10 seconds. Подними руки и держи 10 секунд. Подними руки и держи 10 секунд.
Ben wants to read this one. Can you
All
repeat
right,
one more
Ben,
time?
let's go, Ben.
Okay, which one are we up to?
You're gonna read the lift your arms and hold for 10 seconds, which is подними руки и держи 10 секунд.
Подними руки и держи 10 секунд.
Wow.
Wow, you guys have a Russian speaker over there?
Yeah, да.
Da, okay. Now the second one, lift your right leg and hold for 5 seconds. So подними правую ногу и держи 5 секунд.
Me again?
Who wants to?
Yes, yes, you again then.
Yes.
Okay. Подними правую ногу и держи 5 секунд.
Very nice. Very nice, Ben.
I have a question. Do I sound like I'm from Belgium? What is my accent like? Because when I speak German, apparently I sound like I'm from Belgium.
Belgium. No, maybe not even so. I don't know. I mean, you sound very towards Russian.
Okay.
Okay. We'll have someone else. Let me see who else I have. Sorry, Ahad, I'm not gonna ask you. I'm sorry, Ahad. I know you speak Russian, so what about Ashley? Is Ashley there?
Yes, I'm here.
All right, Ashley, I want to hear your Russian. How
Okay.
about you take this one? Take your right heel,
Oh my gosh.
place it on your left knee, and go up and down your leg. Правую пятку положи на левое колено и веди вниз и вверх.
Okay, you say it one more time.
Правую пятку положи на левое колено и веди вниз и вверх.
Правую пятку положи на левое. Say that one. How do you say that word?
Левое
Левое колено и веди вниз и вверх.
Very good.
Okay.
Правую пятку положи на левое колено и веди вниз, вверх, вниз, вверх. See, you guys have a lot of talents. Good. Okay, now I want to get James over here. James, are you there?
I am.
Very well. Let's take the next one. Take your left heel, place it on your right knee, and go up and down your leg. So, левую пятку положи на правое колено и веди вниз и вверх.
Левую пятку положи на правое колено и веди вниз и вверх.
Wow, not bad, James. Not bad. Very well. Okay, we're gonna get Minnie. Minnie's there?
She stepped out, Galina.
Oh, okay. So then we're gonna take, who else? I already did a lot of you. I think I did everyone. Let me see. Jolene was there. Jolene, you wanna go for next one? It's gonna be tough one. But you can try, or Dima. Who wants? Dima or Jolene?
Okay.
Okay. So so this one is, do you feel me touching you? And which leg am I touching? So, вы чувствуете, когда я вас трогаю? Какую ногу я трогаю? So, вы чувствуете, когда я вас трогаю? Какую ногу я трогаю?
Вы чувствуете, когда я вас трогаю? Какую ногу я трогаю?
Not bad, Julian, not bad. Very good. Okay, so what is this? It's very simple one. It's что это? What is this? Что это? This one is very easy. It's all my co-workers know. Что это? Что это? What is this? So if you're showing a patient a pen, you always say что это? Who wants to say a few of you? Let's do it quickly. One by one. Liz, go first.
Что это?
Good. Srinat.
Прочта это.
Что это?
Что это?
Good. James.
Что это?
Good. Ashley.
Что это?
Good. Shruti.
Что это?
Great. Joanne, what is? How do you say?
Что это?
Что это? Good. Very well. Dima.
Что это?
Wow, you said it like Russian lady. All right. Что это? Great. Guys, you're doing amazing. Okay. And then if you wanted to, so if you have a little bit of, a little something to read for the patient, you will say прочитай это. So это is kind of like this. So it's like this, like это. So if you're going to say что это, it's like what it is. And then прочитай, that means read it, this, what you're going to show them. But of course, it's hard for you, like, you know, like you're not going to probably, maybe you can just show them, like read like a few words that that I have it in this PowerPoint. So if you can say, you know, to read them like mama and a few words of that. And then sorry about the dog. And then if you say like what's happening in this photo, you're gonna say что происходит на этой картинке. Like what is happening on this photo. So that's what что происходит на этой картинке. All right, so let's practice saying the phrases in Russian. Okay. So aphasia testing cards. You know how. Ты знаешь как. Ты знаешь как. Okay, who wants to do this one? Ты знаешь как?
Ты знаешь как.
Great. Okay, down to earth. Вниз на землю. Down to earth. Who wants to say that? James, come on. Вниз на землю.
Вниз на землю.
Marvelous. Okay, I got home from work. So men and women is different endings. So я пришел and я пришла is for the females. So for the men is the я пришел, and for the females я пришла с работы. С работы is going to be the same for both. So men, so Srinat, say for the men, я пришел с работы.
Я пришел с работы.
Very good. And Hazel, try я пришла с работы.
Я пришла с работы.
Very well. So near the table in the dining room. It's возле стола в столовой комнате. It's a tough one because it's stол and столовой. It's for us is like kind of the same meaning. So возле стола. Стол is the table. The dining room, it's for us is like столовая комната. So it's basically стол, столовая, dining room. Dining and the table, it's kind of the same sounds. So возле стола в столовой комнате. Ashley, you want to try?
Возле стола в столовой комнате.
Столовой комнате. So just the apostrophe is, I mean, the sounds should be more on столовой комнате. Столовой, yeah, столовой комнате.
Столовой комнате.
Good. Okay, so they heard him speak on the radio last night, very popular phrase. Вчера вечером они слышали его на радио. Oh, Ben, how about you? So, Ben, you here?
He's on the phone with the consult.
Let
me do this one. Can you repeat one more time?
Sure. Вчера вечером они слышали его на радио.
Вчера вечером они слышали его на радио.
Radio.
Radio.
Okay, good. На радио. Okay, very well. You guys doing amazing. Okay, so if you say
Galina, can I ask you, sorry to interrupt, can I ask you a quick question? So when you do this for Russian speaking patients at Maimonides, do you actually have like a written out, well, I have two questions. Number one is, do you have like a written out version in Russian of those, those sentences that they have to read off? And kind of a follow-up on that question is, do we know, or do you know if there's like a validated NIH stroke scale in Russian? I'm actually not sure. I don't know.
I tried to look for the validated. I didn't find any. So I doubt if there's any. But if we don't really have any, like, we don't have like to show it for the Russians to read it. No, I don't have it.
You just showed the English version, right? And you have them read it.
Yeah.
Okay. Because I mean, I think the languages are similar enough in letters that probably a lot of them are able to, well, they're able to read parts of the words, probably some of the words, not all of them.
I think our speech therapists, they have, because they do in communication evaluation, so they do have Russian version for the Russian speaking population. I can definitely obtain it from them and send it to you.
Okay, great, thanks.
Sure. Okay, so repeat after me. Повторяй за мной. So mama is going to be the same thing. Mama is mama. 50-50, it's hard. It's 50-50. But we don't, I mean, 50-50 is very easy for like in English, but in Russian, 50-50, it's hard to say for the Russian speaking. And thanks, it's спасибо. You probably all heard of it. A lot of like thanks, спасибо. And baseballist is baseball player. And if counting from 10 to 0, so I try to like to write it. 10 is 10, 9 is 9, 8 it's 8, 7 is 7, 6 is 6, 5 is 5, 4 is 4, 3 is 3, 2 is 2, 1 is 1, and 0 is 0. Who wants to try to count? Is Ben back? I want to see how he counts.
Still on the phone.
Still on the phone. Okay, Dima, you want to try?
Can you say them one more time, please?
Sure. 10 is 10. 9 is 9. 8 is 8. 7 is 7. 6 is 6. 5 is 5. You can try some. You don't have to say all 10.
10, 9, 8, 7, 6, 5.
Very well. Thank you. Great. Okay, so that's how we count. Months is, it's kind of easy for, because the months is, when I was trying months, they sound like very similar to Russians. So if January is Yanvar, right? If patient says what current month it is, какой сейчас месяц, patient might say it's Yanvar. So you already kind of hear January, Yanvar. If it's February, they're gonna say Fevral. So it starts with the F, February, Fevral. March is gonna be Mart. Also similar, March, Mart. April is gonna be April. So April, you hear like this kind of sounds the same kind of April, April. May is gonna be May, May. June is июнь, June, июнь. July is июль. August is August. So you see how similar the soundings are. September, сентябрь. October is октябрь. November is ноябрь. December is декабрь. It's like most of the months, it's like very easy. So if you're gonna know this, какой сейчас месяц, right? What is the current month? Какой сейчас месяц? And patient tells you январь, you can like already, it's January, right? Or March. See how similar? Who wants to say the months in Russian?
I'll try. Yanvar, February, March, April, May, Июль, August, all right? September, October, November, and December.
That's amazing. You said it like, I think Dr. Chernak, you can understand, like if, right, like how she reads, how she
I think I will run my rounds in Russian from now on. No, I'm kidding, guys.
That's great. All right, who else wants to try to read the months? Anyone else? Where's Ben? He's still on the phone. All right.
No,
Well,
Ben is here.
all right, Ben, you want to try the months?
Oh, sorry, he's on the phone. Actually, he's holding. Sorry.
That's okay. All right, so counting, and so this is the simplified version of the NIH scale for the Russian speaking population thing for us. But you know, for us in Maimonides on my stroke team, this is what my all co-workers who does not speak English, speak Russian, I'm sorry, that they know all this. So the simplified one is, what is your name? It's как тебя зовут. Everybody on my team like knows как тебя зовут. Srinat, you want to try?
Как тебя зовут?
Yeah, как тебя зовут. So patient.
I've heard all these for 4 years. Now I know what they mean.
All right, finally, you're gonna graduate without, you see, like with knowledge of как тебя зовут. Finally, it's what's your name. All right, so that is one of the most important ones, because patients still will say if their name is Раиса Головин, you could still match it up that the patient is Раиса Головин, right? And what is it? The что это, we already all of us all of us repeated it. Что это? So pen, I wanted you to know, so because patient will say in Russian, ручка. This is ручка. So this is like one of the stuff that you have always with you. You always have a pen with you, and you're gonna say что это. It's gonna, and if they say ручка, you know they can see the object and identify for you what this object is. So pen, ручка. It's very easy. You can all repeat it to yourself. Ручка. If you say look to the right, you're gonna say смотри направо.
Смотри направо.
Смотри направо, okay. Oh, I made a mistake. I said смотри направо. It should be направо. P-R-A-V-O. I'm so sorry. I made a mistake. Oh, no good. So look to the right. Смотри направо. So P-R-A-V-O. My apologies. Look to the left, смотри налево.
Смотри налево.
Смотри налево. You're like a typical translator in electronic translator. Смотри налево. Pick up your arm. Подними руку. Подними руку. I'm sure you all heard of
Подними
it.
руку.
Подними руку. And then leg. Подними ногу.
Одинаково, I told you. Oh, sorry.
What? When did you tell me that? Одинаково?
Одинаково.
Одинаково. You feel the same. So you're not really saying you feel. You're just saying, is it the same? Одинаково. But when you touch the patient on
Wait, when
both
did you
sides,
tell me that?
you kind of saying одинаково. They understand that you mean that they feel you the same. So my Asian co-workers, they tell the одинаково, they usually say да. So you know the word да, you know the одинаково, you know that что это, you know the ручка, you know как тебя зовут, you know the посмотри направо, that means they can move their eyes to the right. The посмотри налево, they know that to move their eyes to the left, unless they don't understand the commands, then they won't really do it. And подними ногу, подними руку, and is it одинаково? Right? So how is it helpful? Do you guys want to try to somebody wants to try like to examine me and say a few things? Ben, I know you wanted to do it.
He said to only be called when something very complicated occurs.
This is very complicated. It's
And here, what is it?
multi-factorial.
I want to show off. What is it?
Okay, so I'm the Russian patient. Ask me a few words, what you just learned. Ask me a few words, ask me.
Как тебя зовут?
Меня зовут Galina.
Let me get a video. Hang on, I'm going to put on the video. Что это?
Это очки.
Okay. Galina, is that right?
Yes. Galina.
I don't know how to say glasses. So I have to...
Glasses очки.
Okay. Смотри направо. Смотри налево. Подними руку. Подними руку. Okay. Other. Подними руку. This one.
Правая, левая. So you
Левая.
see, when you say смотри направо, so it's правая, право, and лево is the left. So право
Okay.
is the right, лево is the left.
Подними руку право. Подними руку лево. Подними ногу.
Okay,
Подними ногу.
okay.
Galina. Подними ногу. Подними ногу лево. Лево.
Левая,
Okay.
левая. So it's a
And now
little bit different thing. Okay.
And now I'm poking you on one side. And I'm poking you on the other. Одинаково?
Да,
Одинаково? I'm poking you on the legs.
да,
Now I'm poking you on the face. Одинаково?
одинаково.
Okay. She's normal.
Okay, thank you,
Great.
Ben.
Dr. Cherniak, I think Ben can be sent to any Russian patient. He can freely get some basic exam without any interpreter.
Agreed.
Okay, very well.
You guys are doing great. I'm really impressed. You all have very wonderful pronunciation.
Yes, I truly, it's you guys are really saying, I mean, I'm really, it's so of course it's not like, you know, I meant to teach you completely Russian. You will just remember, you will not be able to get a thorough Russian history taken and everything. This is just a simple, like simple test just to get an idea if the patient doesn't have like something major. I'm talking about stroke wise. For the neurological exam is going to be a little bit more complicated because you need to really you know, test different reflexes, muscles, whatever you need it in neurologically is more complicated, as usually. General neurology is more complicated than the specific thing. but it's never you know, like it's always room for improvement. And if you just wanted the few things that those, especially the more simplified, the stroke, if you're helping on a stroke team, especially in Maimonides, and there's a patient who's Russian speaking, you can like memorize a few things, which will definitely help you to get a quick exam assessment and you know, be helpful for the stroke team. And
Oh, Galina, can you tell us how to say push and pull?
push and pull. So push is going to be a talkai.
Talkai?
Yeah, let me write it in the chat. Talkai is push, and then a pull is потяни. So it's basically saying потяни меня. So потяни меня. It's like you're asking to pull me, right? Pull me. So pull is потяни, but меня, it's me. So like you pull me, because they're not going to understand. If you say потяни, they might not know what exactly you mean by потяни. But that's also a good, this is a good one. I mean, like, I didn't go like a total, very total, all of this NIH, just the simplified, the very basic ones will be helpful. Because, and then what else, what other words that you usually use that you wanted to know of? Anything else?
How do you say walk?
Walk?
Yeah. How can I ask a patient to walk? Just in one word or a couple of words.
One word, пройдись. Пройдись. It's like you don't have the same words in пройдись. I would say like this, пройдись. So пройдись, it's like walk. Пройдись. Пройдись. You would say пройдись. Пройдись. No, need the Y-O-I. Пройдись. Okay, пройдись. Okay. What's the other words you needed? What are you mostly using in neurology? You probably also use a lot of words like don't move, right? Because when you test in the reflexes, so you say, or like you just say like relax. Relax with the leg if you want to test the reflexes. So you're gonna say расслабься, расслабься. Okay, расслабься. Расслабь ногу, for example, if you're testing the reflex. Расслабь ногу. That means relax your leg. Расслабь ногу. Okay. Or рука, remember, you see this, подними руку, рука. So the same thing, расслабь руку. So then the patient will be like relaxed. What else you using? So you can say those, remember I counting from 0 to 10. When you say, you can say сколько, like if you're showing fingers to test the visual field, you can say сколько. That means how many. Сколько fingers, like пальцы, сколько. Сколько, it's how many. Сколько пальцев, how many fingers you see. And then they might say 9, 4, 7, 3, 2, 1. all these fingers that we counted fingers. Palci. Okay.
And how can I say sharp or dull?
Sharp or dull. Okay, so it's gonna be, okay, sharp is ostrý, and dull is tupoj. So sharp, ostrý, dull, tupoj. So you can say ostrý, tupoj, ostrý, tupoj.
Ostrý, tupoj. Thank you, Galina.
Of course. Ostrý, tupoj. Okay. What else? What other words you use a lot? I mean, most of the times you guys in like Kings counties and downstate, you really don't have much of the Russian population speaking, only like mostly Maimonides. But still, you might have it in your private office sometimes. There's there might be a lot of them, especially now with a lot of Ukrainians came in, and they would understand definitely basic in Russian language. Okay.
Thank you, Galina. This was great.
Thanks, Galina.
I hope it was helpful for you. I will definitely get, I'll speak with my speech therapists and see what they use for the Russian, in Russian version, if they have anything that would be helpful for you to use it. Like if you wanted to hear them how they read, the only thing is you have to understand, like what they read. So
perfect.
Yeah.
Galina, do you mind sharing your slides? The PGY2s need it the most, but a lot of them are not here today.
Of course, I'll send you the slides right away.
Thank you.
I'm so happy you guys were participating. I really hope you learned a little bit of what is the post test. Anyone? I mean, do we know how?
Yeah, Jolene just posted the link in the chat. Guys, just take a minute to submit it.
Yes, please. Thank you so much, Galina. This was wonderful. And yes, please fill it out so that it can help with further scheduling and figuring out what we're doing well, what we're not doing well, how we can improve, what you like, etc. So please take it. And so we know that you're learning.
I just wanted to know how many of you knew the first question. That was the easiest one, of course. And Ahad was able to announce it right away.
I think it was James.
It was James?
Yeah.
It wasn't Ahad. Ahad, I'm taking my words back.
I watched John Wick yesterday, so I know it too.
It's okay. I mean, I really wanted to know who knew. I mean, it's like one of the very simplest ones that we probably hear it every day. Спасибо, да, до свидания, it's like bye-bye. But usually we say пока, it's like bye-bye. And привет, very widely Russian привет is like hi. Okay. I hope this was helpful for you guys. It was nice to hear all of you and to be able to work with you together, at least some periods of times. And I hope whatever you learn, you take it with you further in your future careers.
Thank you, Galina.
Thank you, Galina.
Helpful.
Okay, have a good one to everyone.
You too.
And thanks for inviting me. Bye.
Bye.